Cellulitis of the legs is a common yet frequently misunderstood bacterial skin infection that can bring even the most vigorous individuals to a standstill. This condition doesn't just lurk in hospital wards or dwell among the chronically ill. It can strike anyone, at any age, often catching its victims off guard. Imagine waking up one morning with your legs swollen, red and painful, feeling hotter than the rest of your body. Such symptoms are not just alarming, they are a clarion call urging immediate medical attention. In this detailed exploration, we'll delve into the causes, symptoms, and effective treatment strategies for cellulitis, aiming not just to inform but also to arm you with the necessary knowledge to prevent its occurrence and manage it effectively if it arises. What is cellulitis? Cellulitis is an acute bacterial infection of the skin and the tissues immediately beneath it. It predominantly affects the lower legs, though the arms, face, and other areas can also be involved. The condition results when bacteria, typically Streptococcus or Staphylococcus, enter through a break in the skin. This could be a cut, scrape, insect bite, or even a chronic skin condition like eczema or athlete's foot that disrupts the skin's protective barrier. The symptoms of cellulitis develop quickly and can escalate from mild to severe in a matter of hours. The key signs include 1. Redness that expands around the site of the infection. 2. Swelling and tenderness in the affected area. 3. Pain that can range from mild to excruciating. 4. Warmth over the area, making it feel hotter than surrounding skin. 5. Fever and chills, signaling that the infection might be spreading. It is crucial to recognize these symptoms early and seek prompt medical treatment to prevent the infection from spreading and leading to more severe complications like sepsis or lymphangitis. Diagnosing cellulitis typically involves a physical examination of the affected skin, consideration of your medical history, and sometimes blood tests or imaging studies to rule out other conditions. Once diagnosed, treatment usually commences with antibiotics to combat the bacterial infection. The choice of antibiotic and the duration of treatment depend on the severity of the symptoms and the patient's overall health. For most cases of cellulitis, especially mild ones, oral antibiotics are effective. These are usually taken for 5 to 10 days. In cases where symptoms are severe or the patient does not respond to oral antibiotics, intravenous antibiotics may be necessary. In addition to antibiotics, several home care measures can aid recovery. 1. Resting the affected limb to reduce swelling and relieve discomfort. 2. Elevating the leg above heart level to decrease swelling. 3. Applying cool compresses to soothe the sore area. 4. Maintaining good hygiene and keeping the affected area clean and dry. Preventing cellulitis is primarily about skin care and prompt attention to wounds. 1. Moisturize the skin regularly to prevent cracking and dryness. 2. Treat and cover any skin breaks promptly to ward off infection. 3. Keep nails trimmed and clean to minimize the risk of scratching and creating open wounds. 4. Consider wearing appropriate protective gear when engaging in activities that might injure the skin. For individuals with recurrent cellulitis, doctors may recommend prophylactic antibiotics to prevent future episodes. Seek medical attention if you notice signs of infection, particularly if they are accompanied by fever or significant pain. Cellulitis can rapidly progress, making early intervention crucial to prevent more serious health issues. While cellulitis of the legs is a treatable condition, its potential severity should not be underestimated. By understanding its causes, recognizing its early signs, and adhering to effective treatment protocols, individuals can manage this condition effectively. Remember, the best defense against cellulitis is a good offense, maintaining healthy skin and promptly addressing any injuries. Through vigilant care and awareness, it is possible to keep cellulitis at bay and ensure it does not become a barrier to living a full and active life. Understanding the epidemiology of cellulitis can further illuminate the importance of awareness and proper management of this condition. Statistics reveal that cellulitis affects individuals of all ages, but the prevalence increases with age, primarily due to the weakening of the skin and immune system over time. In the United States alone, there are over 14 million cases of cellulitis annually, making it one of the most common infections leading to hospitalization. Age distribution. 1. Children. While less common in children, cases that do occur are often linked to cuts, insect bites, or underlying skin conditions. 2. Adults. Adults frequently encounter cellulitis, especially if they have skin disorders, chronic conditions like diabetes, or a history of peripheral vascular disease. Elderly. The elderly are particularly susceptible due to more frequent skin injuries, reduced mobility, and other health complications that can compromise skin integrity. Cellulitis does not discriminate by geography, but incidence rates can vary based on healthcare practices, climate, and community awareness of the disease. For instance, tropical and subtropical regions report higher cases of cellulitis associated with insect bites and harsh weather conditions that can lead to skin damage. Developed countries with higher standards of living and better healthcare infrastructure tend to report quicker diagnosis and more effective treatment outcomes, although the prevalence is universally high. Cellulitis is a pervasive condition that demands both public awareness and individual vigilance. By staying informed about the ways to prevent and treat cellulitis, you can take a proactive stance against this potentially debilitating infection. If you found this article enlightening, please like, share, and comment below. Your engagement helps us spread vital information to more people and continue our mission of promoting health and wellness globally. Don't forget to subscribe for more insightful content on common health issues and their management. Together, we can make a difference in enhancing health outcomes.